Okay, can you see the screen?
Yes, ma'am.
Everyone, can you see the screen?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, this is the topic. You can just write it down in your copy. Okay, it's congenital and inherited renal disease. This is a very, very interesting topic. So this is, we almost completed your syllabus for CRD. So it's only 1 or 2 left, I guess. So you write it down. This is the congenital and inherited renal disease. Finish writing the heading? Just write the heading.
Yes.
Okay, okay. Do you know the term congenital? If no, I'll keep on explaining. You just need to respond. Do you know the meaning of congenital? Congenital, do you know the meaning of congenital?
Yes, ma'am.
Okay, can you please share me what is congenital?
Ma'am, it is from.
Yeah, say.
It is by birth, ma'am.
Yes, very good. And what about the inherited?
Ma'am, inherited from parents.
Yes, inherited from parents, right? Okay, it's very good. Okay, student, those who don't know about the differences between this congenital and inherited renal disease means congenital means this is a disease or any kind of physical abnormalities, okay, that are present since birth. जन्म से जो physical abnormality या जो disease वो जो disease है उसको बोलते हैं congenital. And when we talk about the inherited renal disease, inherited का मतलब है जो genetically जो transmit होता है, जैसे कि from among the family members, like from the like mother to the baby, like that, it transmitted genetically. So there is a differences between congenital and inherited. So you understand the differences between congenital and inherited? Yes or no?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, always respond quick, okay? Because if you respond fast, I will increase my speed also, and then we can end our class. Okay, what is congenital disease of the kidney? We already know the meaning of congenital. So now let us discuss what is congenital disease of the kidney. Congenital diseases of the kidney are the renal conditions with which a child is born. Means from the birth itself, the child will have diseases of kidney, like kidney. There will be abnormalities in his or her kidney. So that is termed as congenital disease of the kidney, which occur due to renal failure or renal conditions. Understand what is congenital disease of the kidney? Do you understand?
Yes,
जब से बेबी बॉर्न होगा तब से उसका किडनी में कुछ abnormality या कुछ defect होगा. And you can also, like, you can simply term it as like birth defect. You can write birth defect. जो जन्म से जो abnormalities form होता है ना, तो उसको बोलते हैं birth defect. BIRTHDEFECT, birth defect. Okay, let's move on. So the next is some of the most prevalent congenital disease of the kidney include. One is the number 1. So now we will be mainly discussing about some of the, like the most important or else the most prevalent congenital disease of the kidney. So number 1, what we find is polycystic kidney disease, which I keep on explaining again and again. I have even showed the picture also in my previous class. So polycystic kidney disease is what? This is also a genetic condition, okay? It is a genetic condition in which multiple cysts का मतलब जो mass formation होता है, cysts, abnormal sacs, cysts का मतलब है कि abnormal sac containing fluid and which grows in the kidney. And if it is not properly treated and managed, then what will happen? This polycystic kidney disease can lead to kidney failure. So this is a slight definitions or the slight meaning about the PKD. In short, you can just write PKD. Understand what is polycystic kidney disease? Or the one explanation again? Do you understand? This is congenital disease. Okay, this is the most prevalent congenital disease. Do you understand what is the meaning of PKD? Or I'll
Once more.
explain it once more. Okay, PKD PKD polykidney disease का मतलब है कि I'll show you the picture. Okay, you will understand. तो ये हमारा हेल्दी किडनी है. दिस इज आवर हेल्दी किडनी. लेकिन पॉलीसिस्टिक किडनी कैसा होता है? ये जो है ना, ये जो गोल गोल है, दिस गोल गोल, तो ये क्या है? दिस इज अ सैक. उसको सैक बोलते हैं. इट्स लाइक सैक. तो इस सैक का अंदर में क्या होता है? इट कंटेन ए फ्लूइड. These are the abnormal sac that contain fluid. तो ये जो गोल गोल है ना, बॉल बॉल की तरह, इसके अंदर में फ्लूइड होता है. That abnormal sac का अंदर में फ्लूइड होता है. And if this kind of cyst, that is abnormal sac, if it occurs in the kidney, okay, like this, if it occur in the kidney, then that particular term is known as polycystic kidney. तो इसमें cyst था, इसलिए polycystic. Poly means बहुत ज्यादा, poly means many, mono means one. So polycystic kidney disease. So now can you differentiate the healthy kidney and the polycystic kidney? Can you differentiate? Yes or no? Can you differentiate?
Yes, ma'am.
Yes, ma'am.
Okay, yeah, this is also a congenital disease. Okay, it can occur from birth, this kind of polycystic kidney disease. Okay, now there are also like some types, means two types of polycystic kidney disease. So let us see what are those. There are two types of PKD. If I have written PKD, that doesn't mean in exam you will write PKD, okay? You just always write in full, polycystic kidney disease. Okay, this is the number one. There are two types, right? Let us discuss about the first type. So if I give you only the name also, and if you mention only the name also, it's enough. So number one is ADPKD, in short, ADPKD, which means A stand for autosomal, D for dominant, P for polycystic, K for kidney, D for disease. So in short, you can just write ADPKD. So representing about 90% of all PKD cases. This autosomal dominant polycystic kidney disease, you know, it represents about, out of all the PKD polycystic kidney disease cases, like it represent about 90%. तो 90% का वो polycystic kidney disease है ना, जो mainly autosomal dominant polycystic kidney disease होता है. And the symptoms of this autosomal dominant polycystic kidney disease, typically it present between the age of 30 and 40. So it's like if a child, or if a person suffer from this kind of like polycystic kidney disease that is autosomal, then the symptoms mainly appear or mainly present between the age of 30 and 40. But however, in some patients do develop symptoms. However, in some patients do develop symptoms as children. So this is the number one point. You can just write ADPKD in short. Do you understand? Means like in children, like means like since children, when you are children, at the time also the symptoms can develop, but afterwards, if the symptoms develop, it can develop after the age of 30 and 40. So all these cases are very, very much danger. Okay, done, right? Are you done with this? ADPKD, have you written?
Yes, ma'am.
Okay, let's move on. Later I will give the notes, but I just want you all to write just the short form and all, so that like later if I ask now, you can just memorize it. Next is AR PKD. Here you see, this is AD, right? AD PKD. Just this D will be replaced by R. Just in place of D, you write R. And everything is same. Just the R will be recessive. Before it was dominant, now it will be recessive. So it's very easy to by heart. Autosomal recessive polycystic kidney disease. It is the most rare form of polykidney disease. Here see, in autosomal dominant polycystic kidney disease, it was like very common. It's not like 90% of the cases of polykidney disease cases are seen here, but whereas in autosomal recessive polycystic kidney disease, it is very rare. It is the most rare form of PKD, and the symptoms of this condition begin very early in life, even while still in the womb. Means like here, see, you can just see the differences. Here, the symptoms typically present between the age 30 and 40. जब उम्र 30 होता है या फिर 40 होता है तब उसका सिम्टम्स दिखाई देता है, या फिर चिल्ड्रन में, नॉट बर्थ, फ्रॉम चिल्ड्रन में ही ऐसा दिखाई देता बोला. लेकिन यहाँ पे ऑटोसोमल रिसेसिव पॉलीसिस्टिक किडनी डिजीज में क्या होता है कि इसका जो सिम्टम्स है अर्ली इन अर्ली लाइफ में दिखाई देता, या फिर when the baby is still in the womb, in the mother womb, तब से भी symptoms like you can see the symptoms. So that is the two types of PKD. Do you understand? Mainly the name is required for you all. Do you understand what are the two types of PKD? Yes or no?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. From now, I will keep on looking. Whoever responds less that one, I will ask more. Next. Next, number two. Number one was polycystic kidney disease, isn't it? And there we find the two types, AD, PKD, as well as AR, PKD. Now let's come to the number 2 point. Number 2 point that comes under congenital abnormalities, that is unilateral renal agenesis. In short, you can write as URA. U stand for unilateral, R for renal, A for agenesis. Finish writing URA.
Yes, ma'am.
Okay. In these conditions, what happened in unilateral renal genesis, what happened is that one of the kidney fails to develop. Understand? In utero, one of the kidney will fails to develop. Uni means what? Want. Uni ka matlab hai want. Unilateral, bilateral. Have you ever had this? Unilateral, bilateral. Have you ever had the term unilateral, bilateral?
No, ma'am.
Okay. Okay, no problems. So in these conditions, only one of the kidney will fail to develop in utero. And most individuals with unilateral renal agenesis, they live healthy life and normal life with a little complication. Means like here, both the kidney doesn't fail to develop in utero. It's not it. As only one of the kidney fail to develop in the utero, only one kidney, as we have two kidney, right? Out of the two, if only one of the kidney fail to develop in the utero, then what will happen is that the person will live a healthy as well as the normal life, and he or she will have complications, but the complication will not be that severe. He or she will have little complication. That is the meaning of unilateral renal agenesis. Do you understand? You understand? Yes,
Yes,
or
ma'am.
no? Okay.
Yes, ma'am.
Yeah.
Yes, ma'am.
Okay. Okay, let us move on. Next is the bilateral renal agenesis. Here also it's very easy. It was URA. Just replace U by R, BRA. B stand for bilateral, R stand for renal, A for agenesis. And here what happened, in these conditions, both the kidney failed to develop in utero. In its if in exam, if I gave like write the differences between unilateral renal agenesis and bilateral renal agenesis, what you can write? You can just write that in unilateral, one of the kidney failed to develop in the utero, and whereas in the bilateral, both the kidney failed to develop in the utero. So this is a very, very severe cases. So you understand the differences between unilateral and bilateral? Yes or no?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, let us move on. Now we will be discussing the main interesting symptoms of polycystic kidney disease. So these are the main symptoms, okay, that we will be discussing now. So the main system of, we have discussed three, right? One was the polycystic kidney disease, and the other one was unilateral, and one was the bilateral. So all these three congenital disease of the kidney that we find, all the symptoms we will be discussing one by one. So as I have given you the first point as polycystic kidney disease. So firstly, we will be discussing this. So the main symptoms of polycystic kidney disease, that is PKD, include high blood pressure. So if the person suffer from polycystic kidney disease, then he or she will have high blood pressure. So don't forget this, high BP. अगर किसी का PKD हुआ तो उसका high blood pressure होगा. Okay, next is pain or tenderness in the abdomen. What was tenderness? Tenderness क्या था? Samuel, what is tenderness? मैंने ऑफलाइन क्लास में बहुत बार टेंडर बोल के एक्सप्लेन किया था. पेन और टेंडर, उसका एब्डोमेन में पेन भी होगा और टेंडरनेस भी होगा. एंड देन व्हाट इज दिस टेंडरनेस मीनिंग? Samuel, you have any idea? Shital, you have any idea? Trishna, you have any idea? What is? Say.
Gently touch the.
When you touch, what will happen? Will it be soft or will it be hard?
Ma'am,
Yes.
softness.
Soft.
Soft, really?
Yes, ma'am.
Okay, so soft. Srijana, tender means what?
Ma'am, happiness type.
Pardon, what did you say?
Ma'am, hard or happiness type.
Yes, it's correct. Okay. It won't be soft, paint or tender means it won't be soft, okay? You can't call exactly like hard also, like it's something hard type, but it's not soft. Okay, that kind of feeling you will have in your abdomen if you have PKD disease. Okay, next. Hematuria. I kept telling this in each and every of my class. I guess still like in future when you become old age, then also I don't think that you will ever forget this term hematuria. So Darshana, can you please tell me hematuria, which we keep on like discussing again and again. Hematuria.
Presence of blood in urine.
Okay. Okay then. Okay, very good.
Ma'am,
Yes.
जो हेमाटोरिया के स्पेलिंग जो HAE होगा या HE होगा.
HAE. Oh, it's typing mistake. Okay, HAE. Hematuria. It's typing mistake. Okay, thank you. It's like it's hematuria, but in noun it's like hema, HEMA. Hematuria. It can also be written like this. Okay, and it can also be written HAEMATURIA. Understand? Understand or not?
Yes, ma'am.
Yeah, so like, but we mainly used to write hematuria, H-E-M-A, hematuria. What I have mentioned this, like we mainly used to write this. So, and if you write H-A-E, then also like I won't give wrong, it's correct. Then there will be frequent urination. Ye to pata hai, frequent urinations. No need to explain. And then pain in the site. Pain in the site. Site mein pain hoga. Next is urinary tract infection. So there, and next is kidney stone. All this, everything I explained. So it's very easy. So now see whatever I have given nicely. अगर किसी का PKD हुआ तो उसका क्या क्या symptoms शरीर पे दिखाई देगा. सबसे पहले उसका BP हाई होगा, उसका एब्डोमेन में पेन या फिर टेंडरनेस होगा, हेमाटूरिया होगा, उसके बाद उसका फ्रीक्वेंट यूरिनेशन होगा, पेन इन द साइड होगा, उसका यूटीआई भी होगा, उसका किडनी स्टोन भी हो सकता है. So these are the symptoms that you might see if someone have polycystic kidney disease. Do you understand? Do you understand?
Yes.
Yes, ma'am.
Yeah, okay, okay. Okay, let's move on then. Other symptoms of PKD are, those are the most common symptoms, okay? Apart from those symptoms, there are also other symptoms of polycystic kidney disease. That is pain or heaviness in the back. जो हमारा back pain, you will feel pain or else heaviness in the back. That are the other symptoms. And the next is the skin that bruises easily. Do you know what is bruises? Bruises?
Yes, ma'am.
Okay, you will know all this skin that bruises easily. Bruise. Every one of you know what is bruises? Bruise jo bolte hai. Every one of you know? If there is anyone who don't know, I'll explain for that person.
No, ma'am.
Okay, a bruise, skin that bruises easily means ना bruise का मतलब ही एक common like skin injury होता है that result in a discoloration of the skin. Skin that bruises easily माने जो skin वो बहुत जल्दी injury होता है and that will result in discoloration of the skin. हमारा जो skin color है ना वो discolor हो जाएगा. So that can occur easily. You understand? Yes or no?
Yes, ma'am. Yes.
Okay, let's move on. Then pale skin color, it's same only. If there will be skin that bruises easily होने से तो obviously pale skin color, जो skin color है वो बहुत pale होगा. All this. And then fatigue, which is very common everywhere in every disease. And then joint pains. Here, these are the other symptoms. That is joint pain. And then the fingernail and toenail. हमारा जो fingernail है, हमारा जो toenail है, which abnormalities, you will find abnormalities in your fingernail and in your toenail, such as horizontal ridges across the nail. Means you will find. Wait, okay, my like network connection. Can you hear me?
Yes, ma'am. Yes, ma'am.
Oh, wait, my network connection. Okay. Oh, okay. The fingernail and the toenail abnormalities you will find, okay, such as horizontal ridges across the nail. जो ये जो fingernail, हमारा fingernail का सामने में you will find horizontal ridges. So all these horizontal ridges means, how will I explain? Means like you'll find horizontal ridges means you can see in the like you can browse and Google it the picture, okay, if you want to see it. And then the nails that are somewhat spoon shaped. This spoon shaped nails is very, very common, okay? These spoon shaped nails. So I don't like have the picture. If you want to see, you can Google and see it. Spoon shaped nails, and then concave or white streak and spots. All these abnormalities that you will find in your fingernails as well as in your toenails. So if a person have PKD, these are the other symptoms you can see. So, do you understand the other symptoms of PKD? Do you understand the other symptoms of PKD?
Yes, ma'am.
Okay,
Yes,
Srishna,
Yes,
you
ma'am.
were taking attendance.
Okay.
Okay, let's move on. Next is the one that was all about the PKD, okay? And then the other ones that I have told you all was unilateral and bilateral renal agenesis. So now, first of all, we will discuss the symptoms of unilateral renal agenesis. ईशान मैंने क्या बोला था unilateral renal agenesis का मतलब क्या था? That is URA. ईशान, unilateral renal agenesis क्या था? Isan absent? Isan sleeping? Darshana, can you please tell me what is the symptoms, what is the meaning of unilateral renal agenesis? Darshana.
Yes, ma'am.
Yeah. Can you please say? Time is less. Please say. Okay, no problem. Okay, let's move on. Who will Finisha? Finisha, can you please tell me? Finisha.
Yes, ma'am. In this condition, one of the kidneys fails to develop in utero.
Very good. One of the kidney. Whoever could not answer now, like you listen carefully. Unilateral renal agenesis means it is the conditions where one of the kidney fail to develop in the utero. So what will be the symptoms? You hear the same things like that of PKD. You will see the high blood pressures, and then again, proteinuria, that is protein in the urine, and then developmental defect in the inner ear. There will be the developmental defect in our inner ear, as well as in our genital tract, as well as in our head or else vertebra. So all this developmental defect we will see in all this part or area. That is number 3 point. Number 4 is this glomerular filtration rate. Means you will find that if a person have unilateral renal agenesis, then his or her glomerular filtration rate will be reduced, which measure the kidney ability to filter waste. So यहाँ पे क्या होगा कि GFR का जो rate है glomerular filtration rate है वो reduce होगा, कम होगा. And next is swelling in the face, hand or leg. You might find the swelling in the face, hand or leg. So, Srijana, what do you mean by swelling in the face, hand or leg? What was the term? Swelling in the face, hands
Edema.
or... Yes, very good. Okay. Next is hematuria. Hematuria, again, it comes like that of PKD. And the next is foamy urine. ये भी already. शीतल, foamy urine का मतलब क्या है? शीतल.
जो bubble type
Bubble.
during urination.
Yes, very good. Okay. I want to discuss this more, but the time is very less. So this much we will be discussing for today. So whatever we have discussed today, do you understand everything? Yes or no?
Yes, ma'am.
Okay. Anyone have any doubts? Whatever we have discussed today? Anyone?
Ma'am, utero means uterus.
Yes. Okay. Okay. What about others? This is a very interesting topic, okay? Anyone, any question? Anyone? Mercy, you understand? Is Mercy absent? Mercy is absent. Rudolph? Rudolph?
Yes,
Rudolph,
ma'am.
Rudolph, you have any question?
No, ma'am.
You understand?
Yes, ma'am.
Okay. What about others? Anyone? Anyone? because the next day I will be continue with whatever it is left out now. So that's why like whatever we have discussed up to date, if you have any confusion, keep on clearing on that particular moment. Tomorrow is Eid, right? Tomorrow is Eid. You want to take class?
No, ma'am.
Who's
मैम
there?
मैम
Tomorrow Eid.
URA का स्लाइड शो कीजिए तो
What? क्या बोला?
मैम URA का स्लाइड
क्या का slide?
मैम URA का
Oh, okay. Wait.
हाँ मैम
Okay. मैं दिखाती हूँ, रुको. This one? Okay. If you have anything left out, you can just keep on writing. I'll send the notes on it, but
मैम
just
this one
yeah, okay. Tomorrow
मैम
is
थैंक यू मैम
Eid. Okay, welcome. Tomorrow is Eid, so like according to your
Holiday.
calendar, according to your calendar, it is like holiday. So like, but still, I was thinking you all will want to take class or what?
No, ma'am.
नो मैम
No, ma'am.
And this Saturday is what? First Saturday or third Saturday? This Saturday? This coming
Second.
Saturday? Huh? Second or third?
Second.
थर्ड
Sure.
Third, ma'am.
Third, yeah.
Third, ma'am.
Then according to your calendar,
Okay.
is it holiday?
नो मैम
Yeah, it's holiday according to your calendar.
Yes, ma'am. Holiday.
Oh my God, okay. You understand everything now today? Yes or no?
Yes,
We will be
ma'am.
going to end now.
Yes, ma'am.
Okay. Do you like today class?
Yes, ma'am. Yes, ma'am.
यस मैम
Okay. Then
Yes,
that's all.
ma'am.
That's all for today. Okay, have a nice day. And tomorrow and day after tomorrow, according to your calendar, it is holiday. So enjoy.
Yes, ma'am.
Thank you,
Okay.
ma'am.
थैंक यू मैम
Okay.